Okay, so we're just going to have a look at a few sideline rotation variations. So we're going to start by lying on our side with the knees stacked up and the hands together. Take a big breath in. Exhale, turn and look towards your elbow. Inhale. Exhale. Okay, so that's one simple variation. We can take that a little bit further by just bringing a foam roller underneath one leg, concentrating on really stacking that pelvis up vertically, getting long through that lower leg. Again, beginning with the hands together and thinking kind of long through the head and neck as well. Inhale. Exhale as you turn. So the foam roller will make you sensitive to whether or not you're going to have any rotational movement or kind of change the position of your pelvis. So that's kind of an added benefit of that sometimes. From here, we can do other things like taking that arm straight out, continuing to follow that with your eyes. Sometimes we'll turn the palm of this hand down, and that might help you to relax your shoulders and neck a little bit more. We can breathe in and exhale deeply. So big inhales and exhales are going to manipulate your ribs, and that's really what we want to be kind of mobilizing and helping to develop some of our rotation movement here. Sometimes we can kind of sweep the arm from a sort of reach up and behind the back position to a snow angel overhead, and then reaching even under towards the opposite shoulder blade. Okay, we can look at our rib pulls, and so rib pulls are basically going from here. If you feel a little pinch in between your shoulder blades, you can try grasping onto that top side rib cage and just broadening the collarbones, but using your hand to kind of assist the ribs in the direction that you want to go. And then if that doesn't really help you, you can try the opposite side, so reaching around onto the lower side, exhaling and kind of pulling. Just see if that helps you to turn a little bit further. If those things help a lot, then we know maybe rib mobility is affecting some of that rotation limitation that you're finding. And so, yeah, working with those rib joints could be helpful. Last thing is we can look at our Pretzel stretch. So if we want to take one hand, reach onto the knee here, and then reach onto the ankle at the opposite leg. Bend that heel up towards your buttock, and then just kind of get long through from that knee to the top of your head. Exhale. Inhale. Start breathing deeply. Get those broad collarbones, and begin to look out of the corner of your eye in the direction that you want to rotate. So that's a really nice stretch because it's going to incorporate some of that quad, get a little bit of a diagonal line, kind of opening up. And yeah, so those are our thoracic rotation variations. None of these should be done if you're feeling a lot of pain. As you rotate, these should be comfortable, and you just want to feel like you're able to breathe deeply and kind of loosen up and get a little further into each of these as you go. Oftentimes these couple really nicely with other thoracic extension stretching positions, such as thoracic extension over a foam roller. So again, yeah, that's a direction you may want to go, or working with manual therapy often will be quite helpful in assisting developing these rotations. All right, I hope that helps.